Would you like to know more about Pentax Medical's commitment to infection prevention? Read more about our hygiene commitment on our website.
Optimized and validated reprocessing steps. Without further ado, I would like to give the floor to Paul.
Okay, thank you, Marley, for this introduction. Again, we will talk about training on reprocessing, how to optimize and to validate the reprocessing steps. And it's, of course, always good to look where we are starting. Our starting point is that the decontamination of endoscopes should be undertaken by trained and educated staff in the procedures. And we also had this topic earlier this morning. And it's always about the importance of training and validation, which is also in the statement to pursuant on the German medical device operator regulation. Both manual and automated endoscope reprocessing must be performed with validated processes. It's very important. And what is validation? Well, validation is a documented procedure for obtaining, recording, and interpreting the results required to establish that a process will constantly yield procedures and outcomes complying with predetermined specifications. So that's a lot of words, of course, and, well, it's a lot of words, but it's also regarding to a lot of steps in reprocessing. Just come back on the steps in reprocessing. We have the bedside cleaning, the leak test, the manual cleaning, the rinsing, the high-level disinfection. Again, a final rinsing, and then the drying and storage. And we also already noted that all these steps are really, really important. And the bedside cleaning and the manual cleaning are the most important of it. And how can we optimize and validate these reprocessing steps? As we look at all these steps, the high-level disinfection, when it is performed in an automated endoscope reprocessor, and the drying and storage, when it is performed in a drying or storage cabinet, it are optimized and validated processes. But coming to the most important steps, the manual cleaning, the aim is to achieve residue-free cleaning to avoid negatively impacting the ensuring high-level disinfection. So it's important to do the first thing in the first way and in a good way. But what we learned the last decades is that we have heavily rely on validated technology. Well, we have an automated endoscope reprocessor, so the things are going good and will be going good because it's an automated device. And of course, automated devices, if you look to the automated endoscope reprocessor or the drying cabinets, yes, they are optimized, they are controlled, have a controlled environment, they can be validated. So yes, they have a lot of advantages, which is also mentioned in many documents and guidelines. And of course, when we are talking about advantages, we also talk about disadvantages. Yes, of course, there can be high costs. It requires dedicated user skills and knowledge. More complex and more training is required. That is what we discussed already this morning. And the risk of infection is not regularly maintained. That is what we also discussed. So it's very important to address the advantages, but also the disadvantages. And one of the disadvantages is that if the automatic endoscope reprocessor breaks down, we have to rely on a manual procedure, which is a very risky procedure. So that is why I always put question marks in this. You have to escape to a manual process which is not validated or optimized. And it always starts with those very first step, and we cannot point it out enough, the manual cleaning. Manual cleaning before automated cleaning and disinfection is still the most important step in reprocessing. It's also the most delicate step because it's about the flushing and the brushing. The manual cleaning you see here inside the endoscope channel, and you see on the right picture some yellow debris and contamination. And there can be a biofilm inside the endoscope. And this is a very nice picture of a biofilm inside the channel of an endoscope. And yeah, the advice would be to reprocessing staff, but also to doctors and nursing, if you have the opportunity to can have a look inside the endoscope, please do it. And I hope you will see this one, because this is not good. This is a biofilm. Doing the right thing means also doing the right thing with the right accessories, with the right brushes, the right materials, and the right IFUs, of course. But we still have the human factor. As said, we have to do it with the right and correct and clear IFUs. We also heard IFUs are not easy to read. Yes, they are not easy to read. But we, as Pentax Medical, we improve to make these IFUs better and better readable for all those people in the reprocessing, with nice illustrations and step-to-step what you are going to do. But again, we are depending on the human factor. So we have the IFUs and we have the right products, but yeah, the question is, do we have to kiss more? Yes, of course, kissing is always nice, I think. But kissing means keep it straight and simple. That is the message also which we had this morning in the previous sessions. So we have to develop, and we develop posters with nice cleaning steps, easily to read, easily to perform. And as a new future, we have a new video on manual cleaning, visualizing the flushing and the brushing, and that will be launched very soon. All things to do to help the reprocessing staff to do their things better and more in an easier way. But of course, we have to deal with the human factor. Check, check, and double check. Quality must always be checked. The whole reprocessing chain, every step must be checked. We can do that by improving visual inspections, by the leak testing, cleaning verification test. We also discussed about the microbiological sampling. But do we also have to address tests on the concentrations for the chemicals we are using? And also the drying verification test. Is this endoscope really dry after reprocessing and drying? We have to do it despite all the technology. It's still a human factor. And yeah, there are some examples in which the human factor fails. And this is a nice study. It was published only a few months ago by Corey-Ofsted, and it's you don't believe it when you see this. Sites B and C had a dirty reprocessing and storage area. Site B, they skipped cycles in their reprocessing. They skipped the leak testing and the manual cleaning, and yeah, they relied only on their automatic endoscope reprocessor. So yeah, then it goes wrong. And of course, I know, and we discussed it also in the previous presentation, of course, it remains a daily challenge. It's the bedside cleaning. It's the manual cleaning. It's the high-level disinfection. It's the rinsing. And it's the drying and storage. It's a daily challenge. And yes, yeah, it's an Olympic game. It's an Olympic challenge, which you have to do to prevent the transmission of the microorganisms to the other patient. And we from Pentax think our challenge is to be the game changer and the winner in reprocessing, just like the Olympic Games. And that means that we want to optimize and validate the reprocessing steps. I always like this one, the recent Swiss cheese model, with the levels of defense, the patient safety, and the endoscope at the other side, and what can go wrong if you don't close the gaps in reprocessing. The endoscope is contaminated and will, in fact, contaminate the other patient. And that is why it's so important to optimize and validate the reprocessing steps, to close these gaps. And we will do that by creating a bundle approach with clearly readable instruction, the reprocessing IFU, but also with the introduction of them, the implementation, which is very, very important. The supporting materials, the posters, the videos, also the training. We have to improve the knowledge, the competency and the competition. Initial, of course, when you are starting in the reprocessing, you have to do the course, the education, but also frequently. After 1 or 2 years, you have to prove yourself you are still competent to do the reprocessing. And yes, of course, there should be a certificate with points whatsoever. Of course, coming to the products, we have the best quality accessories, disposable elevator cap, the deck, the disposable brushes, disposable valves, and of course, also the plasma typhoon and plasma bag. And we have to check it by quality tools, for example, audit tools, frequent self-check of the people, self-assessment of the people, or frequent staff peer review. It's very important to close the gaps in reprocessing. And that's also including a visual inspection by magnifying glasses to use, or even a borescope. Or the leak testing. You have to have a good IFU, you have to perform the procedure in a good and the right way, and also the next step, what to do when the leak test failure. The cleaning verification test. Of course, the microbial sampling of the endoscope is very important. It's still the golden standard. But we can also think about the quick test, like the ATP test or protein test, to prove the cleanliness of the endoscope. And of course the drying verification test. Yes, they are possible to look in the endoscope to see if the endoscope is entirely dry inside all channels, or to use indicator paper or a test. And of course the service, the periodic technical maintenance is very important. And it all comes together because when we look frequently with a borescope in the endoscope, we see in an early stage the damages of the endoscope, or becoming damages, or becoming biofilm formation, and then we can serve the endoscope very good. And we will do that because I would say it's in our DNA already. It's our hygiene commitment. First, do no harm. And Pentax Medical provides the solutions to support the treatment of the patients that are based on feedback of the market. We aim to optimize processes to directly tackle patient safety and infection prevention by offering solutions like the DEC duodenoscope, the single-use consumables, the plasma typhoon and plasma bag system. And we prove our strong commitment to these vital topics and will continue developing new products, keeping patient safety in mind. And yes, we have to optimize and validate the reprocessing because, again, first, do no harm. Thank you.
Thank you, Paul, for this presentation. We now have 10 minutes to address some questions that are asked to you.